social.
Very much, Victor Azo, for that background. And now with us in the studios to discuss this issue in further detail, let's welcome Dr. Faisal Shuaib. He is Executive Director and CEO of the National Primary Healthcare Development Agency. Dr. Shuaib, pleasure to have you with us, and good morning.
Good morning, viewers.
Okay, also here with us in the studios is Dr. Mahesh Swaminathan. Dr. Swaminathan is the Country Director, Center for Disease Control and Prevention. Thank you very much for being with us, Swaminathan.
Thank you.
Okay. And last but not the least is Dr. Victor Onukura, District Governor, Rotary International District 9125.
Good morning, viewers.
All right. Okay.
So today, I'll begin with you. Today is 24th October. We celebrate it every year in this country. So what is so special about this year? Because there's absolutely no theme.
Right. Well, thank you so much. You know that since 1988, when the Global Polio Eradication Initiative was instituted, and we had over 350,000 polio cases in over 200 countries. It has never been the same. That it has been brought down to just less than 17,000 or 7,000 polio cases in just 2 countries, and Nigeria has come off it for the past 3 years without any case or report of white polio virus in Nigeria. So for us, it's celebration galore. World Polio Day is marked to kind of sensitize people and also garner resources for the eradication of polio. That's what it has always been. But it has been special this year because by August 22nd, we were officially 3 years without polio cases. And we are now waiting for our final certification. And that final certification that Nigeria will get will mean that the entire Africa will be free of polio. So the celebration has been a 1 week long activity that committed in what we are going to do today, which is the exact day for the World Polio Day celebration.
So you're going to take a walk?
A walk has already been taken place on the 19th, and it was awesome because it has never been the same. We were all there, Rotary and all the partners, World Health Organization, Nigerian Primary Health Care, CDC, and others. It was a wonderful thing. There had also been para soccer that has been on. The final was yesterday, and that was also an awesome experience. It was almost like an Olympic show. Yeah. So then some other things at club levels. The degree of participation we witnessed this year from all the clubs, especially my district, District 9125, that covers 23 states of the Federation and the Federal Capital Territory, has been very awesome as well. So it's some of the local partners, especially our polio ambassador, Emeka Ofo, has also came out to support us massively in this regard.
Okay, thank you very much, Dr. Victor Onukura. I'll return to you in the course of the conversation. Let's bring in now the CEO of the Primary Healthcare Development Agency. We were waiting for the final certification some 3-4 years ago, when all of a sudden there was one case that came up, I think somewhere in the northeast, and then suddenly, we're back to point of origin to see, look, how we could eliminate the white polio virus. Now we're saying 3 years, 2016 to 2019, there's been no reported case. But what, in fact, do we know about the presence or prevalence of the white polio virus in and around the country? Are we scouting for any such incidents?
Right. The effort to look everywhere, in every nook and cranny in Nigeria, is relentless. Though we've gone 3 consecutive years without a single case of wild polio virus, we've learned the hard way that it's not over until it is over. Right. In 2016, after going almost 2 years without a single case of wild polio virus, then we have that reversal in some LGAs of Borno State. So even though we've gone we've achieved this milestone, we know that we have to continue looking, especially in those vulnerable, hard to reach areas that are insecure, to ensure that not only do we ensure that no cases of acute flaccid paralysis is occurring, no child is coming down with weakness or paralysis of the upper or the lower limb anywhere in Nigeria, but that every single child gets the vaccines that they need to ensure that they do not come down with paralysis from polio or any other vaccine preventable diseases. And from all the information we've gotten in our collaboration with Rotary International, with the US CDC, the World Health Organization, UNICEF, the Gates Foundation, all our development partners, it looks very, very likely that we have actually stopped transmission of white polio virus in Nigeria, that there's no single child in Nigeria in the last 2 years that has become paralyzed with white polio virus infection. And that is massive. To go 3 years and maybe never in the history of Nigeria will we ever see a child come down with white polio virus is no mean feat. In all of humanity, only polio will be the second disease that will be completely eradicated. So just think about it for a little bit, that with all the conquests around innovation, we've built the cars, we've conquered the skies, we've gone to space, right? And all the innovations that we can see as a result of human endeavor. And we've only been able to come close to conquering just the second disease, germs. That means this is really a massive effort. And for Nigeria to be at the point where we are finally exiting from that infamous group of 3 nations that includes Pakistan and Afghanistan, we should not take this lightly. While we have crossed the 3-year mark, we do know that we've not been certified as polio-free. That will come next year in June. But it is very, very important that we've crossed this milestone and that we really ramp up all the efforts to make sure that we do not reverse the trend.
3 years ago on this program, when we were almost beating our chests, and then suddenly there was the bad news from Borno. One of the issues that came up in terms of access to hard-to-reach areas was whether migration could prove to be a factor in carefully and properly targeting and therefore identifying persons who had either been vaccinated or couldn't be vaccinated and therefore might be carriers. Borno, obviously, because of its challenges, you have in and out on account of the terrorist activity, in and out, Chad, Niger, they go and then they come. What do we know at this time about such fluid movements and therefore the capacity to target and track persons either for vaccination or to be sure that indeed we don't have carriers of the white polio virus?
You're absolutely right. What the program has done, working again with our development partners and our donors, is to map all the areas where there's immigration, right? Both externally and internally, right? So we've tracked all those immigration routes, nomadic routes, using GIS technology to have a clear understanding of where all of these movements. Apart from nomadic movement, we also have movements, all kinds of individuals that also move for commercial reasons. So we've really situated our vaccinators along these routes, whether they are international borders, state borders, interstate borders, even within a local government area. We know there are markets that attract a lot of international people. There are markets that attract a lot of people coming to sell their wares, and they come along with their kits, right? So we've situated vaccinators in all of these areas and ensure a close collaboration between Nigeria and all neighboring countries to ensure that there's no child that crosses the border without being vaccinated, or at least checking to make sure that the vaccination status of that child permits the child to enter Nigeria. While it is difficult to man each and every crossing point, but in areas around Borno and the northeast, where we know that the risks are even higher, we've prioritized those areas to deploy the most innovative ways of ensuring that we not only are vaccinating kids, but also carrying out cutting-edge surveillance methods that are sensitive enough to ensure that if any child is incubating the wild polio virus and coming into Nigeria from anywhere, that we have the resources. And talking about resources, this is why, people do not know how much Mr. President really contributed to the kind of success that we've seen, right? When we achieved almost 2 years without wild polio virus, and then there was an outbreak in 2016, right? In an unprecedented manner, he called the Federal Ministry of Health and said, go look for more viruses. First, there was one virus. Now, we went back, doubled down into the trenches, and we came up with 3 additional viruses. But we also saw a situation where never in the history of Nigeria, Mr. President released 9.8 billion naira and said, take these resources, make sure that there's synchrony and synergy, not only among states, but even the countries in the West African countries. And we synchronized and had an unprecedented and impressive coordination of campaigns to ensure that we clamp down on the outbreak. And the result is what we're seeing today, 3 years without a single case of wild polio virus.
That's a good achievement. Coming to Dr. Mahesh, as a country director, Center for Disease Control, and we've heard that 3 countries, including Nigeria, still have that virus, and I'm sure you have a lot of statistics going around that. So do you think that projecting into 2020, Nigeria might just be out of it?
Well, I think that we are working with the government of Nigeria as well as our other partners to really make sure that we get there. And I think we are confident that we are getting there, but I think a little bit of humility is important here, to understand that we've gone so far, we've done so well, but continued work and continued vigilance is important. And that even when we get to this point in June, as I say to my staff, the reward for success is more work. And that when Nigeria achieves this goal, then there's more work in terms of ensuring that we have continued surveillance for not just polio, but for other vaccine-preventable diseases that affect children, and that we really have to work together to make sure that children are getting those routine vaccinations. So not just the polio vaccination, but also measles as well. And so this is really important that, yes, we're at a great place right now. We've achieved tremendous success, but in order to hold on to that success, as in any type of success in life, we have to continue to work together moving forward. And I'm really looking forward to being there when we reach this milestone.
Okay, Dr. Swaminathan, thank you very much. But let's get further clarification on this. If Nigeria succeeds in eliminating the wild polio virus from the country and therefore from the African continent, so what? Dr. Victor, would that mean that, look, everybody is free now, we don't get vaccinated against the wild polio virus and so on and so forth?
So like Dr. Faisal has said, we're not going to relax. We must continue to keep surveillance and then continue to ensure that there will be no relapse. So we're not just going to relax to say, oh no, we have free from polio and everybody to your tents, all Israel. We are still gathering resources to the surveillance aspect of it to ensure that there won't be any other recurrence. So.
Dr. Shuaib, I mean, I'm asking this question advisedly. I mean, it's, if the continent conquers the wild polio virus, and that, of course, specific to Nigeria in this particular instance, what next? Would that mean a discontinuation of the routine vaccination program for children who are sub-5? Would that also mean a discontinuation of some of the activities that we have also indicated? Would that mean a relapse into say, okay, all right, the virus is gone, congratulations to ourselves?
No, we're still a long way from discontinuing polio vaccinations. Again, we're at a point where we have to be mindful of the fact that we've not been certified polio-free. So that is likely to come June 2020. But after June 2020, we have to continue vaccination against polio because there are still kids, especially in Pakistan and Afghanistan, which are still endemic countries. And with the fact that the whole world is now a global village, right, you could get importation from those countries. So we have to continue protecting Nigerian kids against the wild polio virus. And long after Pakistan and Afghanistan have exited from that endemicity, we'll continue some polio vaccination for some time until we're sure that the virus doesn't exist anywhere in the world. But very importantly is the fact that it's not just the white polio virus that continues to be a risk. There are many other vaccine preventable diseases. So we do need routine immunization to continue. We do need parents, guardians to take their kids to the health facilities and make sure that they get the full complement of routine immunization vaccines so that we can reduce the number of kids that fall sick and are unable to go to school regularly due to illnesses. And we need to reduce the number of kids that are dying from perfectly vaccine preventable diseases. And these vaccines are free. So I'm calling out on all parents and guardians to use the opportunity of all the free vaccines that are available. We're doing the best that we can to make sure that these vaccines reach the last mile.
Where are these vaccines available?
The vaccines
are they are free.
Yes.
Where are they available?
The vaccines are available in every primary healthcare center. The federal government, again, for the very first time in, as far as I can remember, in the 2020 budget, has over 21 billion naira just targeting vaccines and immunization because of the vision that this administration has to protect our kids against vaccine preventable diseases, to build their capacity. Because one thing that happens is that the more kids fall sick, then we reduce their capacity to achieve, right? They miss school, they do not develop physically very well, even mentally they're not able to develop very well. But if we protect them against these vaccine preventable diseases, then we get the best Nigerians that we can. And with the kind of investment that the federal government is making in vaccines and primary health care, then we're likely to have healthier Nigerians in the next few years.
I'm just wondering, Juma, I mean, the point that Dr. Faisal Shuaib has made is a significant one, but I think that reality probably will set in so that we would know exactly where people can go to, because you are urging parents and guardians, to send their wards for those who need a vaccine to go to a primary healthcare center and get a vaccine.
They can also get it at secondary and a tertiary healthcare centers. So that means in the general hospitals, in the teaching hospitals, in the federal medical centers, they can also get them there. But of course, the primary healthcare centers are the nearest to the communities. Yeah.
Fantastic. Thanks a lot for that clarification, because we do know that, yes, there was an effort to revamp PHCs, that's primary healthcare centers, through the collaboration of the subnational entities, but that program hasn't been a success that was envisaged. HOB. So if parents and guardians can go beyond the primary healthcare centers, they will get the vaccines, and there are no costs, you said.
Absolutely no. Yes, absolutely no cost.
Thank you, Dr. Shuaib. Coming to Dr. Mahesh, how come there has been no total cure for polio so far?
Well, the issue really is that it has been very difficult all over the world, not just in Nigeria, to make sure that every child is vaccinated. And the reason primarily has been because of issues of access, though in this country the government of Nigeria and its partners have really made an effort to try and make the vaccine available. And then issues related to insecurity. I think that in Afghanistan and Pakistan and parts of Nigeria, there is insecurity that makes it difficult for, even if the supply exists, for people to go and get vaccinated. The other issue is that for us to control the polio virus, we need to be able to send people to take a look at cases and try and see if there are further cases of polio. This is not something that can be done if it's unsafe to send people. And so really a lot of the polio has been driven by inability to reach people, not just in parts of this country, but also Afghanistan and Pakistan. So I would say that's really the primary issue. There is some issue, I think, as Dr. Schweib has mentioned about some concerns or some vaccine hesitancy, as we call it. But I think that as parents sort of see the successes involved and sort of see how other children and so forth are really living healthier, longer lives, I think that as we work together to create demand for these really life-saving treatments, that we're seeing that more and more people are getting them. And the government here has really led an effort to increase the coverage of routine immunizations in this country. And it's hard work, and there are obviously a lot of challenges, but there's been a lot of progress.
So accessibility has always been a problem for reaching out to people behind the, insecurity lines, as I would call it, like places like Borno State. You see them walking around. I'm sure I see them, the polio who give these vaccines to the children. They walk around these houses, they knock on doors. At times, these doors are not open. So what level of awareness is being created to ensure that this thing is accepted by everybody so that we can totally eradicate it? So
there's obviously been a lot of health communication, both in public media, social media. I think the most powerful has been, though, working with traditional leaders, traditional leaders both at the highest level as well as at the village level. I think that's actually been very powerful. And we've also achieved success by working with community leaders, to be able to reach people and really advocate for those vaccines. So I think that last part about working with true community leaders and stakeholders has been the most successful. And really, once we started engaging with them, I really think that we achieved a tremendous amount of success. And finally, with religious leaders as well, right? So when you think about, opinion leaders in Nigerian society, I mean, they're really the people, religious leaders, traditional leaders, government, and so forth, working together to really work to get the public, mothers and fathers, really understand the benefit of these vaccines.
Well, thank you. In fact, still on that issue, let's bring in again Dr. Onoku. I'm sure observers will applaud the tenacity of Rotary International in pressing ahead with the vaccination program to seek to eradicate polio. For us in Nigeria, there was a time of intense resistance to vaccination. So in addition to the success factors itemized by Swami Nathan, what has worked in breaking down the barriers to vaccination?
Well, starting from 1985, polio vaccination was an initiative of Rotary. And then we brought in the partners. And in recent times, locally, we have not only gone into massive sensitization. Even for the insurgency areas like Borno and all those places, there was a time it was impossible to get into the areas. And we even had to involve the Joint Task Force, the JTF, to escort people to go and administer this at IPDs. So we have gone that far. And recently also we have involved, like you say, we have involved the religious leaders going to churches and mosques to get this across. Because some of the problems with regard to the resistance also emanate from even some religious standing and cultural differences. So we have been able to break into all these things. And we have recorded a lot of acceptance in recent times. So for us, it's a continuous exercise. In Rotary, we have involved all the clubs to move into communities, to connect with communities, connect with leaders, and to connect with even individuals in promoting the acceptance of polio vaccinations. Yeah, and that is also part of the successes we have recorded. So we'll continue to do that. Yeah.
Okay. Yeah. Thank you. Dr. Faisal Schweib, do we still have issues as recorded a couple of decades ago with regard to the potency of these vaccines, considering that there were challenges with storage and handling?
No, that is a challenge of the past because in the last few years, we've seen a ramping up of the numbers of cold chain equipment. So the oral polio vaccine has to be kept at a particular temperature, and this requires putting them in what we call cold chain equipment. About 10 years ago, 20 years ago, those cold chain equipment were not available everywhere, but we've seen an increase in their availability. As a matter of fact, just working with our development partners and our donors, such as Gavi, we're planning to, flood a lot of the primary healthcare centers, secondary healthcare centers with this cold chain equipment as part of an agreement that is bringing about $1 billion in investment by Gavi into the country. Part of that investment also involves Nigeria contributing close to $2 billion specifically towards strengthening routine immunization and primary healthcare. And a large chunk of those funds really go into procuring cold chain equipment. So we are very confident that the vaccines that are being given to our children in Nigeria are very, very potent. We do not give any vaccines that we have any doubt whatsoever about their safety or their potency, because it makes no sense to drop a vaccine that is not potent to our children. So we've really improved in terms of the immunization program. Clearly, we've not been able to achieve the same level of progress when it comes to strengthening every part of the Nigerian health sector, in terms of improving our tertiary care, in terms of improving our secondary care, and even our primary healthcare centers. We're advocating to governors to invest more in primary healthcare centers, because really, that is really within the remit of the state government, right? We're seeing more governors are now identifying one primary healthcare center per ward that they want to revitalize. Of course, revitalizing this, we always say, is not about going there to give a new coat of paint. It means really making sure that it's refurbished, getting the utilities, getting power, electricity, getting water, making sure that you have the right complement of human resources. You have midwives, you have community health extension workers, you have doctors, making sure that you have the drugs and the commodities in at least one primary healthcare center in every ward, so that people can come and have basic services. We are very conversant with the fact that this is not going to happen overnight, right? But we're engaging with the state and saying that over the course of the next 10 years, can we commit, for example, to ensure that a proportion of Nigerians will be able to have basic health care within the next 2 years? And then how many can you now project for the next 5 years, the next 10 years? And we see that governors are beginning to invest more. So there's hope in the future for strengthening of primary health care and other levels of care. And that gives us more confidence that we'll be able to achieve the aspirations of Nigerians for better health care.
All right. Thank you very much, Dr. Shuaib. Dr. Swami Nathan, yes, the emphasis has been getting children vaccinated, children, obviously those below 5. But who else may be vaccinated?
So in this case in Nigeria, really for polio, we're talking about persons under age 5. And I think that really should be the focus of where we are going. There are some other routine immunizations, for example, tetanus, right, that we do that are of interest, particularly in women who are planning or going to become pregnant. But when we think about sort of a hierarchy of how we implement, vaccines, I mean, really children are really the key. And if you're able to really vaccinate children, you're then able to protect themselves, but also their parents, brothers, sisters, uncles, aunts from vaccine-preventable diseases. So really right now, the real focus is on vaccinating children.
I'm asking this question because, is it possible for an adult to contract the white polio virus? And if the adult does, how does it manifest?
So it is possible. However, with adults, because there's been so much vaccination occurring in the past, the risk for adults is much less. Remember, children are being born every day. And so as these children, sort of progress through life, if they're not vaccinated, then there's a chance for them getting sick. So older adults, may have been exposed in the past. They may have already been vaccinated, so the risk for them is less.
All right.
So we have a number of tweets,
here. Let's quickly go through the tweets and then return to our guests to get their closing thoughts.
Yes, we begin with Dele Jack Solomon. He tweets, "The true heroes are women, mostly young mothers and volunteer community members who went door to door, slipping drops of polio vaccine under the tongues of as many as 30 million Nigerian children. We commend the volunteers' work with UNICEF and the Gates Foundation to achieve this."
Mike Ayankwo has this tweet. Now, kudos to the health authorities for getting us to this point. We must sustain it and use the experience to tackle other diseases in the health sector. We must train and retrain health personnel on constant basis. And a healthy nation, of course, is a great nation.
And Law Alpha C tweets, "The future of this country lies in the inventive abilities of the youth in all areas of human endeavor. We ask that such should be made available from time to time a forum like this to discuss issues on polio and the rest."
That's right. Prince Vikid tweets, says polio would have been eradicated a long time ago, but was delayed by suspicion and religious opposition to the treatment. In some parts of the country, they believed that the white man's vaccine was meant to reduce their population and also to indoctrinate them. We thank God for the public enlightenment to dissuade the antagonists of polio vaccination.
And Comrade Alhaji Ngala tweets, "Recently Nigeria was declared a non-polio endemic country. This is good development, but government should focus on malaria by providing mosquito nets to the less privileged, most especially those in rural areas."
Steve Bond, to completely defeat the disease, people at the grassroots should be educated on religious and superstitious beliefs that prevent the vaccination of their children. The National Orientation Agency could do more as well.
Yes, and Aikiju Olagbaju tweets, "The virus is easily contracted through bad water and food. It is therefore important to pay attention to rural areas that are extremely short of good and potable water."
Abdul tweets, "Now the need to sustain the tempo should be maintained. The contributions of individuals and organizations should be mentioned and highlighted. Rotary Group, Bill Gates, Dangote, UN agencies, and others, plus individuals, should be commended."
And Uche Gabriel tweets, "Rural dwellers are the people most affected in the spread of the infectious diseases. This virus is easily contracted through bad water and food, as earlier stated. It is therefore important to pay attention to rural areas that are extremely short of good and potable water." I think it's a reputation of that. Talking about partners, Dr. Shaiub, what's the role of the Global Polio Eradication GPEI partners in Nigeria?
The GPEI partners have been very critical in the progress that we've made. We probably wouldn't have made as much progress and as rapidly if it weren't for that close collaboration, especially in terms of their technical input, the financial input. We found a situation where the GPA has also been able to engage local partners and local donors such as the Aliko Dangote Foundation that has really gone beyond just polio eradication, but also strengthening routine immunization. As a result of the partnership between the Bill and Melinda Gates Foundation and the Aliko Dangote Foundation, you've seen a memoranda of understanding existing between these foundations and states, whereby states are now able to put in money into a pot along with these foundations targeted at strengthening primary healthcare and routine immunization. So really that partnership has been very, very, very important. And it's as a result of this partnership that we're now beginning to think critically about what next. So here we are, we've been able to eradicate smallpox. But the lessons from smallpox we lost before we started with polio eradication. So we had to relearn what it meant to eradicate a disease. But this time around, we're not going to make the same mistakes twice. So in country, with our partners, we're beginning to think now that we're on the verge of being polio certified, being polio free, how do we use these resources that have provided this kind of results, right? This is formidable, right? To be able to do this is formidable. The same polio eradication workers were the same ones that actually eradicated Ebola. Recall that in 2014, while other countries were suffering, because we had a very strong polio eradication program, we deployed them to Lagos and Port Harcourt and stopped Ebola in its tracks. It is the same polio eradication program that is now increasing routine immunization. We've seen an unprecedented increase in routine immunization coverage in the last 2 to 3 years, again because of the polio program. What we're looking at is how do we reimagine primary healthcare? How do we use these resources, these health workers, these frontline workers you've talked about that have learned how to go door to door, open doors and talk very nicely to community members. How do we strengthen that? Exactly.
How do you do that, Dr. Shuaib?
Right.
Because the critical element in this, amongst the mix, donor funds. By the time we get certified polio-free, you can be certain that the stream of donor funds will likely dry up at some point. So if those donor funds dry up, what are we going to do? So what internal capacity are we generating to be able to undertake this on our own without recourse to donors, local and mostly foreign?
Absolutely. That is the point I was trying to make. So we're at a point where the donors are already ramping down their funding, right? Even before certification. But we're not folding our arms and waiting for that to happen. In the 2019 budget, 2020 budget, the federal government, under the leadership of President Muhammadu Buhari, has graciously maintained the funding for polio eradication activities, knowing very clearly that those funds are going to ramp down. But we're also transitioning those resources, those human resources, those capabilities that we've learned towards strengthening primary health care and global health security. So we're working to use these same resources along with the Nigerian Center for Disease Control, the NCDC, working together with NHIS as well, to say we will not allow these human resources just disappear. So we're advocating to governors. Governors now have to look for ways of bringing some of these very skilled individuals into the civil service so that they can continue to operate at the same level where Nigeria is being hailed globally as a country that has demonstrated innovation and resilience when it comes to polio eradication.
All right. Thank you very much, Dr. Shuaib. Dr. Mahesh Swami Nathan. Is there citizen responsibility post-white polio elimination from the country?
Absolutely. Public health is a public good, and it requires the actions of individuals as well as their government institutions. And in this case, I think this is a win-win situation for everybody. When your child gets vaccinated, you protect your child. You protect yourself. You protect your neighbor. You protect your country. Very few things in life are as easy as that. And I think that this really is a case for both individuals and government institutions, public institutions, to really make sure that the sacrifices that have been made by polio workers, the amount of money that's been spent, all the work, that success continues forward and is consolidated.
Okay, thanks.
Yeah, and it isn't like white polio isn't like cholera, for instance, where personal hygiene is critical, is it?
It is critical as well.
So that's why I was asking about citizen responsibility.
Yeah, absolutely. Yeah, I mean, water and environmental sanitation are very critical because cholera, just like poliomyelitis, are fecal oral infections. That means when you have bad hygiene, people don't wash their hands, then it's easy to contract them. That is why it is particularly common among children. So apart from ensuring hygiene, personal hygiene, environmental hygiene, there's also debate that parents and guardians have a responsibility to ensure that they provide and make an opportunity for kids to get their vaccines. And it's very, very clear in the Child's Right Act that it is criminal for any parent to deny their kids the opportunity of being vaccinated against vaccine-preventable diseases.
Don't you think that it boils down to lack of education, high
Clearly.
level of illiteracy in some of these areas?
That is very, very critical, right? The fact that people don't have adequate information, and this is why the traditional leaders, religious leaders, are very, very important when it comes to providing information and engendering trust in communities so that they know clearly around how a disease is caused and how are they prevented and how they should work with government to ensure that they have the right information and they take the right steps to protect their health.
Thank you so much, Dr. Shuaib.
All right, Jumai, I mean, part of what Dr. Faisal Shuaib was talking about just now, personal hygiene.
Yes.
The Ministry of Water Resources also runs the campaign of Wash.
Yeah.
wash, for people to wash their hands, just soap. You use the washroom, wash your hands.
What if these amenities are not there?
Well, we'll get them provided in the first instance. It's very important. And the way to wash your hands, I learned that if you use the washroom and then you have soap, it isn't just that you start running water on your hands.
No, you have to, it's like technically.
It's happy birthday to you. I don't know, today is World Polio Day, so
Kingsley.
happy birthday to all those.
Dr. Victor, what is the climax of the World Polio Day going to be like?
Well, the climax is that we, beyond celebrations, we're taking it to the next level. Rotary has always been proactive in, evolving some of these issues that have to do with disease control, and we also have programs beyond even polio in our 6 areas of focus. The water and sanitation program we have, the disease control, which is, even the WASH we're talking about is also a subject of Rotary initiative. Yeah, sure. We commend government.
But the champion in Nigeria is the Minister of Water Resources.
The truth is that Rotary hasn't got the capacity to sell some of these programs directly to people. Yeah. That's why right from time we try to bring in partners. World Health Organization to give you the imprimatur of internationality, and then the government to also take it to the next level, to get it to the roots. And in Nigeria in particular, the Nigerian Primary Health Care Development Authority, especially since the coming on board of my friend Dr. Fazal, has done tremendous work to support whatever we are doing. So the next level is for us, we're even the ramping down of international contributors who also have been working on local partners. 2 days ago, I had a meeting with the Sir Emeka Foundation. By the way, he is the Rotary International Polio Ambassador to Nigeria for the fact that he has given over $3.something billion to our cause. So we are trying to ensure that we encourage them not to relent, even in the absence of international donors and contributors. So beyond this celebration today, we are having a roadmap to encourage and encourage the plus of Polio Plus. That is all the initiatives that have to go with polio. Right.
All right. It's on that note, we'd like to thank Dr. Victor Onukwuha. He is District Governor, Rotary International District 9125. Thank you for being with us in Good Morning Nigeria today.
Thank you.
Our appreciation also to Dr. Mahesh Swaminathan, Country Director, Center for Disease Control and Prevention. Thank you for being with us. Dr. Faisal Shuaib, CEO, National Primary Healthcare Development Agency. Thank you for being with us on Good Morning Nigeria.
Thank you for having me.
All right, it's Good Morning Nigeria still on the network service of the NTA. We'll take a short break. Now, when we return, we'll take on our second topic for conversation. Joshua Gushen, thank you. And also Esosa Ukmoma, General Manager, NTA ETV. Thank you for being with us in Good Morning Nigeria.
Thank you.
All right, that does it for our 2 topics. Let's go now to sports.
Nigeria cricket team lost their third